Researchers and policymakers from all over the world came to visit the World Forum in The Hague for the working conference Health Services Research in Europe. And we are here to ask them some healthy questions. What do you expect of this working conference?
To learn more about health services research.
I have been interested in European policy and research for years, so this is an opportunity to share what is happening here and what is happening in Canada and to have some comparison.
I hope we'll have good results in terms of moving the agenda for health service research further in Europe and to see how countries do it differently. And I'm particularly interested in policy, contributing to a report, so let's see where we end up with this.
I think it might contribute to the interaction between researchers and policymakers. That would be a big success if that would happen.
Well, I'd like to meet new people, to meet new ideas, since probably there are a lot of them, and we differ. We are in United Europe, though we differ a lot.
Well, certainly I'm looking forward to the opportunity to meet European colleagues. I haven't done much of that as yet. Because I'm relatively new to research.
A lot of policy dialogues to influence healthcare in a positive way. We are nurses ourselves, so we expect something for the little profession, nursing. So.
I expect to get a lot of input for the further development of a research agenda for health services research in Europe.
Oh, great interchange between countries and great effort to improve health services research in Europe. Yeah, expect a lot, yeah.
What do you consider a priority for health services research in Europe?
Gosh, that's a big question. Health services research priority. I guess, if I were to pick a topic area, my inclination would be to go with how can we better support self-management. I think in the future, patients are going to want greater and greater roles in health system, in making decisions about their health care, but I think we have very little knowledge about how we can best support them to do that. So we've typically had a model where physicians, nurses have played a significant role in patients' lives, but more and more we need to figure out how can we support them in making decisions about their own care that allows them to live well with the many chronic conditions they often have.
I think it's necessary share this research, this subject.
I think planning is important and health technology assessment.
If you ask somebody else from another country about what the system is, and they tell about the system, but they forget the points that are completely normal to them. So it's very difficult to communicate with other people on their healthcare systems. And if you have more information about the differences in the healthcare systems, you can more easily, I think, compare the different systems and transfer solutions from one system to another system.
To establish the more transparent occasions of exchange and linkage between researchers and policymakers.
Well, one of the things which was brought up already in the discussion, which I think is very, very true, that if you want academia to be involved, it has to be rewarded in the academic world. So not only the New England Journal of Medicine citation, and lots of citations, but a societal relevance.
Well, I think priority should be to study what a private sector or public sector is better, which one is better, because we are seeing a lot of privatization in many countries of health services, and I think we need a lot of evidence on this issue.
My priority in health service research is the exchange between organizations, to look at micro level. not on the macro level, but to exchange information on a micro level.
What do researchers or policymakers need to do to make research more policy supportive?
Well, they should try to identify also the real stakeholders, so it's not just the communication between policymakers and researchers, but also the real end users should be involved in the process. That's because very often people think that the policymaker is the customer, but actually sometimes they intend that hospital directors or something like that.
I guess the policymakers need to, in general, ask questions that are answerable by research, and vice versa.
Researchers tend to be very one-minded focused, so I think there should be more mutual collaboration in terms of developing a research project, so from start till the end of a project. So it should be more multidisciplinary collaboration.
The research is adjusted to the policy at your country, so the policy has to come first, and then the research has to be done according to the policy, and not vice versa.
We did our research and hope it will help you with future policies.